So, welcome everyone. Hello, ma'am, and thanks for
Hi,
giving us the time today. So,
thank you so
as you
much.
all know, we all know that schools have started, and but yet the attendance is the question. And my first post itself mentioned that I was amidst a discussion with moms, and some of them were convinced that yes, they want to send the children to school, but one mom says that no, I'm not going to, and the whole scenario changes. So I thought, let's approach an expert like Dr. Nita Jagad, who is a pediatrician. At the same time, she is an expert in training about emotional quotient. She's extremely passionate about parenting with emotional intelligence, and this is one topic on which she has conducted several parenting workshops. So nobody could be better than her to comment on this particular topic from the physical health as well as from the emotional health perspective. So, thank you so much, ma'am, for giving us time today and joining us for this interactive sessions. What we have done is we have collected some questions from the parents so that the discussion should be in the flow, and we'll be asking you these questions. In addition to that, if we are getting questions from the audiences also, we will take them up for sure. Okay. So,
Sure, sure.
without any further delay, I would like to start with the first question. That schools did reopen in the month of September, and we did a wonderful session with you about the things that parents must know as children go back to school. But they had to shut down because of Omicron. So, keeping this background in mind, is it really safe to send our children to school? Because on one hand, their health, but at the same time, even if considering the age group, they may not get infected, but they will be the carrier, so they could, will they create risk for the elderly people in the family?
Yeah, at the outset, let me thank you, Leena, for this opportunity to talk at this platform. And let me congratulate you for beginning the discussion on this very important topic. So,
Thank you.
Leena, according to your question, I really understand the concern which parents and school authorities are going through. But most important thing is we cannot really overlook the benefits of physical school as against online school. So that is one thing which we should know. And secondly, in India now and even world over, we have seen that Omicron is found to be highly infectious, contagious, and has infected a large population at once. Now, although it is highly contagious and infectious, but the severity of infection is much low. So it's a milder illness which it causes, and that is one of the good news. And it requires very negligible number of hospitalizations. So of course, as you said, when children go to school, they are going to come in contact with each other. They are going to get infected at times, but the infection is going to be very, very mild. So, one of the data, according to one of the Indian data, during mid January, there were about 3 lakh cases per day. Okay. And during December, mid December, Delta was a predominant variant. And very quickly, by mid January, Omicron has taken over, and that has become a predominant variant now. To the extent that Omicron is almost 80% of all COVID cases in India, and 20% were Delta cases. So we know that the variant which is circulating in air is a milder variant. It is causing milder illness, so we should be slightly, relaxed. At the same time, we should not let our guards down. We should take all the appropriate precautions. So there is always a theoretical possibility of getting infected and infecting the family members, but the infections are very, very mild as compared to the Delta variant. And that's why we shouldn't be so scared or so worried about. And Fortunately, whatever you say, in children overall, all COVID symptoms are much less severe than they are in adults. And they generally, most of them improve with symptomatic treatment within 3 to 4 days of time. And I feel now it's no point keeping the schools closed, because see, if you see, children are traveling everywhere. They are going everywhere except to the school. So they
Yeah.
are going to restaurants, they are going for holidays, they are traveling with their parents. Even parents are traveling outside. Parents are
Right.
going for their work. So in that case, now when any family member goes out, children are constantly exposed. So it really doesn't make any sense to continue to keep the schools closed. And on the part of our government, the decision which it has taken to reopen the school is definitely very appropriate.
Okay.
But
So
yeah,
yes,
can I
yes.
just
Please go.
few?
Yes, yes.
So
Go ahead.
only thing to remember when children go to school is not to let our guards down, continue to take COVID appropriate precautions, and children should be made aware of all these things. School authorities or in the schools, they should follow the COVID task force guidelines, which we have already said earlier, but I would just repeat it in brief. So
Yes,
school should work at 50% capacity. The attendance, they should have a schedule where 50% will attend from school, in the school, and 50% will attend at from home online, and they will alternate on different days. Then children should be made aware of and taught how to wear mask, how to wash their hands, and how to keep social distancing. They should try to avoid lift using lift, and also school buses, so that there is not much crowding. Those who can go by their private vehicle or walking to the school, they should do so, so that there is no crowding in the buses and in the lifts. And the classroom should be made well ventilated and avoid air conditioners. Now, initial few days, children should be allowed to settle in the schools, and too much of importance should not be given to studies. So these are all COVID task force recommendations. And and during this surge, the children are most of the children are seen being affected. We have seen families being affected with this Omicron. But the good news is that the infection is very mild. Most of them improve within 2 to 3 days with only symptomatic treatment. So I don't think we should be worried so much about sending children to school, and it would be much quite safe to send them to school.
okay. So I believe the questions which Tulika ma'am has asked over here, that we are preparing for hybrid classes, but parents are not willing to send. So how to convince them? So the answer given by Dr. Nita Jagad, I believe you will get your pointers to build confidence among the parents, as well as what are the precautions that as a school the organization should take. So that coming to the second question, that of course
Yeah. So
online
can I
schooling.
just add, Leena, here for this question which Tulika madam has asked?
Yes, yes, please.
Yeah. So basically, when you start, leave the option to parents to go to school. So there will be few children who are very happy to go to school. They are so excited, and some parents are also very excited to send their children. So once they start going and everything goes well, school also tells them what arrangements they have made for children, and just be transparent about what is happening inside the classrooms. Then the parents who are reluctant to send will become little more confident over a period of time, and they will also start sending their children to school.
Okay, that's a very, very valid suggestion, ma'am. So, coming to the next question, that online schooling did a fantastic job in terms of bridging the gap, and as they say, saving the generation from the whole education aspect. But on the flip side, many of the teachers in the know-how also, they say that the writing skills of the children, they have dramatically worsened, because in the basic spelling mistakes they are doing, because now they are not used to writing. They just type one or two letters and the whole spelling comes. So this is the scenario now. Also, the focus has drastically gone down, because they are on available on internet, so distractions are several. So considering this situation, and now the schools are opening up, so which significantly which actually drives that why one should be sending to the school, what are the physical and emotional wellness precautions that parents as well as schools should be taking?
Yeah, so you are absolutely right that online schooling has really done a good job. So, in fact, one of my sixth standard patients, she told me that she has become a pro in handling these gadgets and the online platforms, and now she can guide her teachers how to go about. So that's the skill they have really mastered, you know. But yes, as you said, these skills of writing, focus, and social skills, all these skills have suffered a lot. So how can we help our children? And like during this lockdowns, so many children have not seen the school for last 2 years. They have not been at all, they have not sat at one place. So once they have not seen the school, they were sitting at home for almost 2 years, not going to play outside, not meeting their relatives, not meeting their friends. So obviously their socializing skills, their talking skills, their communication skills, all these skills have really suffered. And in our practice, we are seeing lots of cases of panic attacks, attention deficit disorders, hyperactivity. Then, some children, the small babies who are born during this time, their speech is delayed because they have not met people around. Then,
Correct.
some elder, bigger children are having emotional outbursts. They are not able to express their emotions and feelings. They cannot communicate their problems to their children. In fact, one more thing which is very seriously affected children is there's an obesity epidemic in
Absolutely.
children, which is parallelly going on with the pandemic, and that also needs to be taken care of. And obesity in children definitely brings down their self esteem, so they are mentally affected. Now what we as parents and teachers need to do is we need to be very empathetic towards them. We must understand, try and understand what they feel, what they want to tell, and help them finding or giving options to whatever their problem is. We must give them some options and help them coming to solutions, rather than, we give them ready made solution, aisa nahi aisa karo, aisa nahi aisa karo. So those type of solutions should not be given to them. Rather than that, if we give them options and let them choose what is best for them and support that choosing, or maybe, we can um guide them choosing the option, best option. We can tell them what is good and what is bad about that option and let them choose. So they will be empowered, their self confidence will improve. About the obesity, I said the diet and exercise should be started. Encourage more of solo sports so
Okay.
that they become more confident. Of course, they should start once. Now we have seen the number of cases are definitely going down. So slowly they can start going to play their exercises. They also can be done. Then small children, when they are going to school, we should tell them about the school. We should start talking to them about their school, how it looks like, how the classroom will look like, how their teacher is going to be. The teachers are going to be very friendly, and you are going to meet your friends over there. You are going to play with your friends. You will have a lot of talkings with your friends. There are going to be lots of stories in the school. So when we start talking to them like this, the children feel prepared going to school. Okay, it doesn't give them a lot of stress. Then secondly, encourage them and practice sitting in one place through some activities. So for so
Okay.
many years they have not been sitting at one place, so we can do some activities with them where they can sit at one place, they can concentrate, where their focus will improve. So they can have such games, and we can start these things this at home. Now schools have already started, but after they come back from school, this as a recreational activity we can start. Secondly, we can teach children the mindfulness meditations, which will
Okay.
improve their concentrations, their anxiety levels can go down, and certain breathing exercises also can be taught to them. Then we can teach them anger management. So they have temper tantrums. So when they are having their anger, we can make them aware, we can teach them that you should be aware what is anger, what are the feeling fingerprints of anger. So what happens when you are getting angry, what happens in your body, go inside and find out. So your breathing becomes fast, your heart rate becomes fast, your eyes pop out, you start talking very loudly. Okay, and your fists are clenched and your muscles become tight. So this is when you are getting angry, so you should accept that you are getting angry. And how to manage anger, there are tools we can teach them. To wait for 6 seconds. So how do you wait for 6 seconds? So 6-second pause technique. So they can just count 10 from reverse. So 10, 9, or they can alternately count 1 to 10 in Hindi and English. So that is one thing. So these are the techniques we can use with children to counter their anger episodes and their whenever they are angry. We can show them turtle technique. So what is turtle technique? Turtle technique is whenever there is some stimulation from outside, when the turtle is feeling angry, what he does is he waits, he pauses, then he goes inside the shell and he thinks. Then, once he is calm and quiet, then he comes out.
Yeah.
So, for you can use this turtle technique for small kids as well as big kids. And children can, whenever they start understanding that they are getting angry or they are having some emotional outbursts. So, in that case, they can act like a turtle. That is, they can pause. They take their hands inside rather than shouting, rather than hurting people or
Hmm.
hurting themselves. They can
This is a
go
very
in, take 3 deep breaths, then come out and then act what is to be act and communicate their anger. So this can be taught to children.
this is
And
very important
another,
because uh,
yeah,
I mean, I have observed such things, especially amongst the younger age group or the preschoolers, because it's been 2 years, they have not gone anywhere. The social interaction is very limited, and they are amongst all the adults. So they're getting angry very fast. They don't know how to respond or how to deal with uh, elder people who are elder to them, or also with people who are of the same age group, because घर में तो इनकी ही मनमानी चलती है. So
yes,
that's the reason the anger management thing is very important,
very
considering
important.
the isolation that these children are facing. Otherwise, they would have been amongst the their peers, and over there they cannot do things that they do with their parents or grandparents who are pretty elder to them. So it's a very good
Yes.
suggestion.
Yeah. So
Okay,
that's how we
so
can prepare them.
okay, that's a good thing. Now coming to teenagers, vaccination has started for teenagers, and it has got a good response in the initial phase itself. So, what is your comment about the same? That
Yeah. So
about I mean, also managing if in case there are any side effects of this vaccine amongst the children, what is it that parents and the children should be aware about? What should we be prepared for?
yeah, okay. So about vaccination, I want to say that please immunize your children as and when it is available for their age and when their turn comes. Okay, so they should be vaccinated and immunized. Now these vaccines are going to prevent severe illness in children and even their family members. So in India at present, the vaccines which are authorized, okay, in children are less than 15 years. I'm saying as of now, no vaccines as of now, but they will still come. I mean, very soon, less than 15 years, children also will be vaccinated. 15 to 18 years children, recommendation is co-vaccine, and more than 18 years, they have a choice of Covishield or Covaxin. Now, in India, we have started vaccination on 16th of January 2021. Okay, it was given free of charge to everybody. It was also available in some of the private setups at a nominal fees. Now, children less than between 15 and 18 years of age, vaccination is started from 3rd of January 2022, and booster dose for healthcare workers, for people more than 60 years, and those having comorbidities, the booster has been started from 10th of January 2022. Now, by now, up till now in India, we have administered 141 crore doses of vaccine, which is a historical milestone in our history. Okay, some of the studies, some of the papers are saying 1.7 crore, and one paper said 1.141 crore doses. Out of this, 90% of the adults are given first dose of vaccine. 62% of the adults have been given two doses of vaccine. So we have a data, very wide data of immunizing such a large population. Okay, so, and government of India is keeping a close watch on the side effects of the vaccine, the effects of the vaccine, as well as the strategies, and creating the strategies of vaccination stage wise through two bodies. One of them is Task Force for Focused Research on Corona Vaccine, and second is National Expert Group of Vaccination Against COVID. Now these two groups are studying side effects very closely, and they found that in children, severe adverse effects are very, very low. So they are quite safe in children, and they should be given. And the minimum, the very mm, milder side effects, I would say, are fever with chills. Then they can have headache, body ache, swelling, and induration at the site of injection. But only what is necessary and what is required is good hydration of the child, that is, give them lots of liquids, let the child rest for 24 to 48 hours, and oral paracetamol should be given, and it will take care of all the symptoms and they will disappear in 24 to 48 hours. Now, uh, severe side effects are very rare. They can be from anaphylaxis, that is severe reaction, low blood pressure. Then some children, some of the vaccines, not Indian vaccine, of course, uh, the Pfizer vaccine has been shown to have some cardiac side effects, but they are very, very, very rare. And in children, it has not shown so many side effects, so they are quite safe for children, and you should take the
So
vaccinations.
all in all, the summary is that the vaccine is well observed. It is undergoing continuous scrutiny, and the side
Yes.
effects, especially in the younger population, are very much controlled or very minimal or very rare. So people should and can confidently take the vaccine and complete the dose of the vaccine.
Yeah, they have found the vaccine so safe that they are being given the mRNA vaccine, which are in USA. They are
Okay.
USA has given vaccine from the age of 5 years. So they've
Okay.
started vaccinating children from the age of 5 years. And even the pregnant women are being vaccinated. Even the breastfeeding mothers are being vaccinated. So those
Okay.
vaccines are found that safe.
Okay. Coming to the COVID symptoms, in case, I mean, despite of all the precautions, in case if there are some chances that yes, child might develop COVID or might test positive for COVID, then what are the symptoms that parents should take note of immediately, and what should be the action plan then?
Yeah. So the COVID symptoms, most many a times children can be asymptomatic and may not have any symptoms at all. So there, so we nobody will know. But when the symptoms are there, the symptoms are fever, maybe mild or very high grade fever with chills and shivering, headache, body ache, leg pains, throat pain, cough, cold, breathlessness. Sometimes oxygen saturation less than 94% on pulse oximeter. They can have loose motions, vomiting, abdominal pain, lethargy, weakness, and other family members also might have similar symptoms. So these are given us present scenario, and considering a lot of omicron cases or covid cases in the society, so we should consider it as covid unless proved otherwise. So first thing we should do is do not send the child to school or play. Okay, stay at home and give oral paracetamol for fever as and when required. Okay, but do not repeat before 4 to 6 hours. Plenty of liquids to drink, and frequent small feeds to maintain the nutrition. Let the child rest. Monitor temperature and pulse oximeter, the oxygen saturation. Monitor also the urine output and consult your doctor. Now, the red flag signs or the signs where you need to immediately go to nearest hospital or your doctor is frequent vomiting or persistent vomiting, poor oral intake, decreased urine output, child is remaining drowsy or lethargic, and there is breathlessness, and uh, pulse oximeter, on pulse oximeter the oxygen saturation you find is less than 94%, then you should rush to the hospital. Don't wait, just consult your doctor.
That was really very helpful. One question that, okay, again, Tulika ma'am is asking that any chances of getting vaccine for preschoolers? So any update if you have in
See,
India?
See, at present, there are no contraindications, or they have not found any side effects or any concerns to not give vaccine to small children. But at present, government is considering or trying to cover the high risk population, the elders, the healthcare workers, people with comorbidities. So the availability of the vaccine, which it is used for adults who have more severe symptoms. Now, in any case, children are going to have milder symptoms. Most children are having very mild symptoms. So they would at present are the last priority. And secondly, once we have a solid data about giving vaccination to adults, elderly people, then the preschoolers will be given the vaccination. But it will
Okay,
come definitely.
really hoping for the same. Uh, and one last question that we keep getting, that do you advise flu shot before sending children to school, or do you advise flu shot otherwise also, which will be helpful in preventing COVID infection or Omicron infection?
Okay. Yeah, this is a very good question, Leena, and very important for parents to understand. Yes, it is definitely very good to give all the vaccines which are available as per schedule. So when you give flu vaccine, so when you give chickenpox vaccine, it is going to prevent against chickenpox. When you give flu vaccine, it is going to prevent against viral flu and not against COVID. Okay, so that has to be kept in mind. So flu vaccine is not for COVID at all, and it has no relation with COVID, which I have seen many parents have that in mind, that if we give flu vaccine, then my child will be prevented from COVID. No, will not be prevented getting COVID. It prevents only viral flu and not COVID. You should keep that in mind.
Okay, so that was very helpful. So I think we were live for about 40 about 30 minutes with you. So I would just request you to sum up the whole discussion
Yes.
in terms of pointers, and then we can have closing.
Yeah. So I would say the take home message here is it's a good decision on the part of government to reopen the schools. Okay. Children should be taught and made aware of COVID appropriate behaviors. So we can tell them three W's and two V's. So what are these three W's? Watch your distance, wear mask, and wash your hands. Three V's are ventilation and vaccination. So ventilation is, you should be sitting or you should be in a place which is well ventilated and open, rather than sitting in a stuffy places or crowding in a stuffy places. So that is ventilation should be taken care of, and vaccination. So you should get vaccinated as and when it comes. Now follow the school should follow COVID task force guidelines, okay, properly, which we have said. And children should be given time and space to adjust in the new environment before we push them to lot of studies, and immunize all children against COVID-19 who are more than 15 years of age. So these are my take home messages, Leena.
Thank you so much, ma'am. So I think what we have, the whole purpose of this discussion was that there is a lot of confusion, there is a lot of fear about sending children to school, but maybe COVID is going to be there in different forms. It's time that we take this calculated risk, we learn, and we take a very informed decision. And that's what the whole
Yes.
agenda of this discussion by GenX Parenting today. Thank you, all the viewers, and thank you, ma'am, for always being so supportive in terms of sharing insightful information with the audience. Thank you. Good night,
Thank you so
everybody.
much. Yeah, it was my pleasure, and thank you so much for everything. Thank
Thank
you, dear.
you.
Okay.